Patient after patient sat in front of me, saying the same thing. I did everything right. And yet their heart still failed them. It wasn't their diet, not their lifestyle. It was something they trusted enough to take every single day without question. And when I finally saw the pattern hiding in their medication list, it changed the way I practice medicine forever. What if it's already sitting in yours? If you're serious about taking better care of your health, make sure you subscribe. I share simple, practical advice designed especially for seniors. And feel free to leave a comment telling me where you're watching from. I appreciate every one of you. Let's get back to it. There's a pattern I started noticing years ago, and I genuinely wish I had caught it sooner. It wasn't dramatic at first. It was quiet, almost invisible. A detail that kept showing up in patient histories like a word you suddenly can't stop seeing once someone points it out. Patient after patient. Different ages, different backgrounds, different lifestyles, but the same story. They exercised. They watched their sodium. They took their medications faithfully, every morning, without fail, the way a good, responsible patient does. And then, without warning, something happened to their heart that nobody saw coming. I remember one man, retired, active, proud of the fact that he hadn't missed a single morning walk in 4 years. He sat across from me after his discharge and said something I've never forgotten. "Doctor, I did everything right, so why did this happen to me?" I didn't have a clean answer for him that day, but I started digging, and what I found shifted the way I approach every patient over the age of 60. Because the answer wasn't his diet, it wasn't stress, it wasn't genetics hiding in his family tree, it was something sitting quietly in his medicine cabinet, something labeled, something prescribed, something he had been told, without question, was helping him. I'm Dr. James Cross, and in this video, I'm not here to alarm you or talk you into panic. I want to be very clear about that. Do not stop any medication on your own. Always speak with your doctor before making any changes. That is non-negotiable. But what I am here to do is show you something most people are never shown. Because most conversations at the pharmacy counter last about 90 seconds. And 90 seconds is not enough time for what I'm about to walk you through. Here's what the research tells us. And this is important. After 60, your cardiovascular system becomes measurably less forgiving. A study published in the Journal of the American College of Cardiology found that adults over 60 show significantly higher vulnerability to vascular stress triggered by external factors. Blood vessels lose elasticity. Drug metabolism slows. The margin for error narrows in ways most people don't realize until something goes wrong. That means a medication that was perfectly safe at 45 may not behave the same way in your body today. And here's the part that stopped me cold when I first put all of this together. One of the medications on this list is so normalized, so deeply woven into daily routines, that most people defend it even after complications arise. They don't question it, because nobody ever told them to. That changes today. Let me show you what I now double-check in every single patient who walks into my office over the age of 60. Before we get into the medications themselves, I need you to understand something first. Because if you skip this part, the rest of it won't land the way it should. Think of your body at 40 as a well-maintained highway system, wide lanes, flexible barriers, traffic flowing smoothly in both directions. A minor disruption here or there, and the system absorbs it, reroutes, recovers. You barely notice. Now, picture that same highway at 65. Some lanes have narrowed, the barriers have stiffened, traffic takes longer to clear. And when something enters that system, something that creates extra pressure, extra resistance, extra load, the consequences are no longer minor. That's not pessimism. That's physiology. After 63 things happen inside your cardiovascular system that change everything about how your body handles medication. First, your blood vessels lose elasticity. Healthy arteries are designed to flex. They expand when blood pressure rises and contract when it falls, acting like shock absorbers for your heart. But with age, the walls of those vessels gradually stiffen. The medical term is arteriosclerosis, and research published in the Journal of the American College of Cardiology confirms it accelerates significantly after the 6th decade of life. When your arteries can no longer flex the way they once did, Any medication that adds pressure to that system hits harder than it used to. Second, your liver and kidneys slow down. These two organs are your body's filtration system. They process every substance that enters your bloodstream, including every pill you swallow. But after 60, both organs begin to work more slowly. Drugs stay in your system longer. They build up at higher concentrations. A dose that cleared your body in 6 hours at 45 might linger for 10 hours at 68. That's not a minor difference. That's the difference between therapeutic and toxic. Third, your clotting and fluid balance become harder to regulate. Your body is constantly managing a delicate balance between blood that flows freely and blood that can clot when needed. After 60, that balance becomes more sensitive, more reactive to outside interference. Introduce the wrong compound into that system, and you don't just nudge it slightly, you can tip it. Now, here's where it gets serious. Most medication dosages, the numbers printed on that label, were studied and established primarily in younger adult populations. The 60-plus body wasn't always the reference point. So, when certain drugs interfere with vessel flexibility, or slow fluid clearance, or shift your clotting chemistry, the consequences at your age can be dramatically more significant than the same drug in a 40-year-old. Your body isn't broken, it's just less forgiving. And that's exactly why what comes next matters so much. Because we're not talking about obscure drugs or rare prescriptions. We're talking about medications that are sitting in millions of homes right now, taken daily, trusted completely, and almost never questioned. Starting with number 6. It starts innocently enough. A blocked nose, a heavy head. That suffocating cotton-stuffed feeling that makes it impossible to sleep, impossible to focus, impossible to feel like yourself. So you do what most people do. You reach for the little box at the back of the medicine cabinet, the one that's been there for years, the one you've used 100 times before, and you take it without a second thought. Within the hour, you can breathe again. The pressure lifts. You feel human. And nothing about that moment feels dangerous. But here's what's happening inside your body while you enjoy that relief. And this is the part nobody explains at the pharmacy counter. Decongestants work through a mechanism called vasoconstriction. In simple terms, they tighten blood vessels. Now, that sounds targeted, right? Like they're just tightening the swollen vessels in your nose to clear the passage. And yes, that's the intended effect. But your body doesn't work in isolated compartments. When that drug enters your bloodstream, it doesn't read a map. It doesn't say, only affect the nasal passages. It circulates, and as it circulates, it begins tightening blood vessels throughout your entire body, in your limbs, in your chest, and critically, in the vessels surrounding your heart. Think back to what we just covered about aging arteries, vessels that are already less elastic, already working harder, already carrying less margin for error. Now, add a compound that actively squeezes those vessels tighter. What happens to your heart? It has to push harder. It has to generate more force to move blood through narrower, more resistant pathways. Your blood pressure climbs, not gradually, but within hours of taking that first dose. A study published in Hypertension Research found that common decongestant ingredients, particularly pseudoephedrine and phenylephrine, can produce significant blood pressure elevations in older adults, sometimes within 30 to 60 minutes of ingestion. And in a cardiovascular system that's already less forgiving, that spike doesn't just come and go quietly. I had a patient, 67 years old, managed hypertension, otherwise healthy, who took a standard over-the-counter decongestant during a bad cold. He wasn't worried. He'd taken it before. But this time, by the second day, his blood pressure had climbed to a level that brought him into my office looking pale and shaken. He hadn't changed his diet. He hadn't missed his regular medication. The only thing that was different was that small box of relief sitting on his nightstand. Now, here's what makes this particularly dangerous for people over 60. Many decongestants are packaged inside combination cold and flu products, multi-symptom formulas, the kind with long ingredient lists on the back that most people never read. So even if you know to avoid straight decongestants, you may be taking one without realizing it, hidden inside a product labeled simply as nighttime cold relief. The twist is brutal in its simplicity. The same compound opening your airways is simultaneously closing down your arteries. you feel better on the outside, while your heart works harder on the inside. This is why I tell every patient over 60, before you reach for that box, turn it over. Read the active ingredients. Look for pseudoephedrine. Look for phenylephrine. And if either of those words appears on the label, have a conversation with your doctor or pharmacist before you take it. Relief shouldn't come at the cost of your heart. And what comes next, number 5, is something even more people take without hesitation. Something you probably have within arm's reach right now. If decongestants are the medication people defend because they feel harmless, then NSAIDs are the ones people defend because they feel necessary. And I understand that completely. When your knees ache getting out of bed every morning, when your lower back tightens after an hour in the garden, when a headache settles behind your eyes and refuses to leave, you don't want a lecture. You want relief. Fast, reliable, familiar relief. So you reach for ibuprofen, or diclofenac, or naproxen, the most trusted painkillers in the world. Medications so normalized that most people don't even consider them medications anymore. They're just something you take, like vitamins, like water. And that familiarity is exactly where the danger hides. Here's what's happening beneath the surface when you swallow an NSAID. These drugs work by blocking specific enzymes in your body called COX enzymes. When those enzymes are suppressed, your body produces fewer prostaglandins, the compounds responsible for triggering pain and inflammation. That's the mechanism behind the relief. And it works. There's no question it works. But prostaglandins don't only manage pain. They also help regulate blood pressure. They help protect the lining of your blood vessels. And critically, they play a direct role in maintaining the natural balance between clot formation and free blood flow. When NSAIDs suppress prostaglandins, they don't just turn off the pain signal, they shift your blood chemistry. They reduce the protective compounds in your vessel walls while simultaneously increasing the conditions that favor clot formation. In a younger body with resilient vessels and robust circulation, that shift is manageable. The system compensates. But in a body over 60, where vessels are already stiffer, where circulation is already working with less reserve, that same chemical shift can tip the balance in a dangerous direction. A landmark meta-analysis published in The Lancet, covering over 350 individual trials and more than 130,000 patients, found that certain NSAIDs are associated with up to a 30 to 50% increased risk of major cardiovascular events. That includes heart attack and stroke. Not rare, not theoretical, 30 to 50%. Think of it this way. Your circulatory system depends on precise chemical signals, like traffic controllers managing a busy intersection. NSAIDs don't just slow one lane. They reassign the controllers entirely, and when nobody's managing the flow, things collide. The part that troubles me most as a physician, most people taking NSAIDs regularly have no idea this risk exists. They were handed a box, told to take 2 with food, and sent on their way. No discussion of cardiovascular history, no mention of dosage limits, no follow-up. Just trust the label. If you're over 60 and using NSAIDs more than occasionally, that conversation with your doctor is not optional. It is overdue, because the pill you take to feel better may be quietly shifting your body toward its greatest risk. And what comes next? Number 4 is one that genuinely surprises people, because this one doesn't feel like a painkiller. It feels like protection. Someone in your family is probably taking one of these medications right now, thinking it's completely harmless. If you don't share this with them, who will? Subscribe and pass this video on. There is no rewind button on a preventable cardiac event. This one feels different from the others, because when people think about medications that could stress the heart, they think about stimulants, they think about blood thinners, they think about drugs with long warning labels and serious-sounding names. They don't think about the small white pill that stops their chest from burning. But that's exactly what we need to talk about. Proton pump inhibitors. Most people know them by names like omeprazole, lansoprazole, or pantoprazole. They're prescribed for acid reflux, heartburn, and stomach ulcers. And the relief they provide is real, genuine, almost immediate. You take it before bed. The burning stops, you sleep through the night, life feels manageable again. And so, you take it the next night, and the night after that. Weeks become months, months become years. The prescription gets renewed almost automatically at each checkup, because nothing seems wrong, because you feel fine, because the heartburn stays quiet as long as you keep taking it. And that's precisely where the problem begins. Here's the mechanism that most patients, and honestly many doctors, never discuss. Your blood vessels depend on a molecule called nitric oxide to stay relaxed and flexible. Think of nitric oxide as the body's natural vasodilator. It signals your arterial walls to open up, to maintain healthy blood flow, to reduce the workload on your heart. Now, research has shown that long-term use of proton pump inhibitors can interfere with an enzyme called DDAH, dimethylarginine dimethylaminohydrolase. That enzyme is responsible for breaking down a compound that blocks nitric oxide production. In plain language, when PP is disrupt that enzyme over time, your body begins producing less nitric oxide. And when nitric oxide levels drop, your blood vessels gradually lose their ability to stay flexible and open. They stiffen, they narrow, and your heart has to work harder to push blood through them. This isn't theoretical. A large observational study from Stanford University, analyzing the health records of nearly 3 million patients, found that people taking PP is long-term had a significantly higher incidence of heart attacks compared to those who were not. And critically, this risk appeared even in patients with no prior history of heart disease. Let that sink in. A medication designed to protect your stomach lining, quietly affecting the flexibility of your arteries. The short-term use of PP is, when genuinely needed, is a different conversation entirely. These drugs exist for a reason, for active ulcers, for severe reflux disease, for specific clinical situations. They are appropriate and often necessary. The danger lives in the long-term, unreviewed, automatic use. The patient who started taking omeprazole after a stressful period 5 years ago and has simply never stopped. The person whose prescription renews every 3 months without a single conversation about whether they still need it. I've seen this more times than I can count. A patient comes in for something unrelated, and buried in their medication list, behind the blood pressure pill and the vitamin D, is a PPI they've been taking daily for 6 or 7 years. Nobody flagged it, nobody questioned it. It just became part of the routine. If that sounds familiar, if you've been on a proton pump inhibitor for longer than you can clearly remember, that is your sign to sit down with your doctor and ask one simple question. Do I still need this? And if so, is there a safer long-term plan? Because comfort is worth protecting, but not at the cost of the arteries that keep you alive. And if that surprised you, number 3 is going to hit even closer to home, because this next one isn't just in medicine cabinets, it's in gyms, it's in supplement stores, it's being marketed directly to people your age, promised as the answer to everything time has taken away. We live in a world that has decided slowing down is a problem to be solved, and the market has answered that belief, with an entire industry built around one promise: feel sharper, move faster, do more, regardless of your age. So, it shouldn't surprise anyone that stimulant use among adults over 60 has been quietly climbing for years. Some are prescribed, medications for focus and attention that were once associated almost exclusively with younger populations, now appearing with increasing frequency in the medicine cabinets of older adults. Others come without a prescription at all, marketed as natural energy boosters, cognitive enhancers, pre-workout formulas, fat burners, products with clean labels and confident claims, sitting on shelves in health stores right next to the vitamins, and people take them, genuinely believing they are doing something good for themselves. Here's what's happening inside the body when they do. Stimulants, whether pharmaceutical or supplement-based, work by triggering a surge of adrenaline and related compounds in your system. That's the mechanism behind the alertness, the focus, the sensation of having energy you'd forgotten was possible. But adrenaline doesn't just sharpen your mind, it accelerates your heart rate, it raises your blood pressure, it pushes your cardiovascular system into a state of heightened demand. the same physiological response your body produces when it believes you are under threat. In short bursts, in a young and resilient system, that response is manageable. But in a body over 60, where vessels are already stiffer, where the heart is already working against greater resistance, sustained stimulant use creates a very different picture. A 2023 population study published in JAMA Network Open found a measurable and statistically significant increase in cardiovascular risk among long-term stimulant users, with the effect being notably more pronounced in older adult populations. The heart rate climbs, the blood pressure rises, and day after day, dose after dose, the system absorbs that extra load silently until it doesn't. What makes this particularly difficult to detect is that stimulants feel like health. The person taking them feels more energetic, more capable, more like the version of themselves from 20 years ago. There are no obvious warning signs, no immediate discomfort, no red flag moment that prompts a conversation with a doctor. The body keeps score quietly, and this extends beyond prescription stimulants. Certain herbal supplements, guarana, high-dose ginseng, synephrine, carry similar adrenergic effects. They raise the same alarm bells inside the cardiovascular system. The natural label does not make them safe. It simply makes them less supervised. If you are over 60 and using any stimulant, prescribed or purchased off a shelf, this is a conversation worth having with your doctor before your next dose. Because borrowed energy always carries interest, and your heart is the one paying the bill. Number 2 is next. And unlike stimulants, this one doesn't promise energy. It promises something far more seductive. It promises that the pain will simply disappear. There are few things in medicine that work as dramatically as corticosteroids, and I mean that in the most literal sense. A patient walks in, barely able to lift their arm, shoulder inflamed, movement impossible. They've tried everything: rest, heat, over-the-counter painkillers. Nothing has touched it. One injection, 48 hours later, they're back in my office telling me it's a miracle. The pain is gone. The stiffness has vanished. They feel like themselves again, sometimes for the first time in months. And I understand why that experience creates loyalty. When something gives you your life back that quickly, you don't question it. You're grateful for it. You ask for it again the next time things flare up, and the time after that. That's human. That's completely reasonable. But here's what's happening beneath that relief, beneath the reduced swelling and the returned mobility that most patients are never shown. Corticosteroids work by powerfully suppressing your immune and inflammatory response, and they do that job extraordinarily well. But that suppression doesn't happen in isolation. It triggers a cascade. First, fluid retention. Corticosteroids cause your body to hold on to sodium in water. That means increased blood volume. And increased blood volume means increased pressure on the walls of your arteries and your heart. Second, blood sugar elevation. These drugs signal your liver to release stored glucose into the bloodstream while simultaneously reducing your cells' sensitivity to insulin. Even in people who have never had a diabetes diagnosis, corticosteroid use can drive blood sugar into dangerous territory. Third, lipid disruption. Steroid use alters your cholesterol profile, often raising LDL, the harmful fraction, while reducing HDL, the protective one. That shift quietly accelerates plaque buildup inside your arteries. Fourth, and most critically, increased clotting tendency. Research published in PLOS Medicine found that prolonged corticosteroid use is associated with a significantly elevated risk of cardiovascular events, including heart attack and stroke, particularly in older adults. Here's what makes this especially deceptive. The relief is immediate and visible. The damage is slow and invisible. You feel better on the surface while a cascade of metabolic changes accumulates silently underneath. And it's not limited to injections. Oral corticosteroids, prescribed for everything from severe allergies to autoimmune flares to respiratory conditions, carry the same systemic effects. Even extended courses of inhaled steroids at high doses have shown measurable cardiovascular impact in some studies. Think of it this way. Corticosteroids are like silencing the fire alarm. Instead of putting out the fire, the noise stops, the panic fades. but the underlying problem continues to burn. If you've been on corticosteroids for more than a short prescribed course, or if you find yourself returning to them repeatedly for the same condition, your doctor needs the full picture of your cardiovascular health before the next prescription is written, because the relief is real, but so is what it costs your heart. Now we come to number one, the one that generates the most debate, the one surrounded by the loudest promises, and the one I've seen cause the most unexpected complications. Listen carefully for this next part. If this video reaches you at the right time, it might protect someone you love, but if it doesn't reach them at all, that's a regret you'll carry. Subscribe right now and share this, because information moves faster than emergencies, but only if you let it. Everything we've covered so far has been about medications people take to manage something wrong: pain, congestion, acid, inflammation, fatigue. But this one is different. This one is taken to recapture something right, something people feel slipping away with time and desperately want back: vitality, strength, drive, the feeling of being fully alive in your own body. And the industry built around that desire is worth billions of dollars because the desire itself is completely human. Testosterone therapy is marketed with a particular kind of confidence: the before and after stories, the language of restoration. Feel like yourself again. Turn back the clock. Reclaim what age has taken. And in genuinely confirmed cases of clinical deficiency, where blood work clearly shows abnormally low levels and symptoms are directly linked, testosterone therapy absolutely has its place. I want to be precise about that. But here is the problem I've watched unfold in real patients. Not everyone who receives it actually needs it. Levels that are simply on the lower end of normal, adjusted for age, are sometimes treated aggressively. Symptoms that have multiple possible causes get attributed to testosterone without thorough investigation. And the therapy begins without the monitoring infrastructure it demands. Here's what happens inside the body when testosterone is introduced without proper indication. Testosterone stimulates the bone marrow to produce more red blood cells, a condition called erythrocytosis. More red blood cells means a higher hematocrit, the proportion of your blood that is made up of solid cells rather than fluid. In plain terms, your blood gets thicker, and thick blood doesn't flow the way it should. It moves sluggishly through vessels that are already less elastic after 60. It increases the resistance your heart pumps against. And most critically, it dramatically raises the risk of clot formation in coronary arteries, in cerebral vessels, in the deep veins of the legs. A study published in JAMA found a measurably increased risk of cardiovascular events, including heart attack and stroke, in certain populations shortly after beginning testosterone therapy. The risk was most pronounced in older men and those with pre-existing cardiovascular vulnerabilities. I had a patient who came back after 3 months of treatment glowing with confidence, stronger, more energetic, sleeping better. From the outside, every marker of success. But his hematocrit had climbed to a level that made me stop the conversation entirely and order an immediate workup. He hadn't felt anything wrong. That's exactly what made it dangerous. Feeling better is not the same as being safer. And that distinction, that single critical distinction, is what I want every person watching this to carry with them after today. Testosterone therapy is not inherently the enemy. Improper use, without confirmed deficiency, without baseline cardiovascular screening, without regular monitoring, that is the enemy. If you are currently on testosterone therapy, or considering it, these are the 3 non-negotiable questions to ask your doctor. Was my deficiency clinically confirmed? Has my cardiovascular health been fully assessed? Are my red blood cell levels being monitored regularly? If you cannot answer yes to all 3, the conversation isn't finished yet. Thanks for watching all the way through. Staying informed is key to living a healthier, longer life. If you want more simple, practical health advice, make sure you subscribe and tap the next video on your screen. And before you go, leave a comment and rate this from 1 to 10. Your feedback helps me create better guidance for you.